A Pap test is an office procedure that clinicians use to help detect precancerous or cancerous cells on the cervix. It can also be used to help detect the human papillomavirus, which we know leads to these abnormalities. It is usually performed at an annual exam. However, it can also be performed if a patient comes with a problem. We know that cervical cancer is the fourth most common cancer worldwide. Cervical cancer develops in a patient's cervix, which is the entrance from the vagina into the uterus. We also know that most cervical cancers are caused by human papillomavirus, HPV, which is transmitted through sexual contact. Most HPV infections will resolve spontaneously. However, persistent infections will lead to abnormal cells on the cervix as well as cervical cancer. Through Pap tests, we have been able to detect these abnormal cells early and the HPV virus, and leading to increased treatment for patients and decreased incidence of cancers in the United States. The test involves a patient coming in for a pelvic exam. During this time, the clinician will usually insert a speculum into the vagina, which is a device that allows us to both visually inspect and evaluate the cervix. The clinician can then use a small brush to remove cells from the surface of the cervix, and those cells are then sent in a liquid media to the lab for analysis. The lab will look at the cells to see if they are abnormal, the degree of abnormality, as well as the presence for HPV. If an abnormal result is obtained, management will depend on the patient's age and Pap test history. Some patients may be recommended to repeat the Pap test in 1 to 3 years. Other patients may be recommended to undergo a procedure called a colposcopy. During this colposcopy procedure, a solution is applied to the cervix that will help to show the abnormal cells, and a clinician can decide to perform a biopsy or remove that tissue for further analysis. This then helps to characterize the abnormal cells and provide more management options. If the results from the colposcopy are further abnormal, the clinician may recommend the patient to undergo a LEAP procedure. That is a surgical procedure where a portion of the cervix may be removed to further diagnose and/or treat the condition. Pap tests should start at 21 years old regardless of sexual activity. Paps are regularly discontinued at 65 after a discussion between the patient and their clinician. Other ways to promote cervical health include making sure you have your regular appointments with your clinician and having exams done as recommended. It is also recommended when you are sexually active, especially with new partners, to use condoms to help prevent infections. Lastly, smoking cigarettes are highly discouraged, as that not only affects your overall health but can impact your cervical health as well. Getting your regular routine appointments, especially things like having your Pap test, can help save your life and your family members. I highly recommend you schedule an appointment with a clinician as soon as possible, and you can reach us at womenshealthct.com to schedule your appointment today.